Good day, everybody. My name is Leung. I am a University of Alberta Faculty of Pharmacy graduate, and I currently work as a pharmacist at Strathcona Prescription Center. Today, I'm going to give you a quick and brief overview of the most commonly used medications used in osteoarthritis. And of course, we'll be talking about Acetaminophen, which everybody knows as the brand name Tylenol, and NSAIDs, which are non-steroidal anti-inflammatories. Some of those include ibuprofen, naproxen sodium, and most commonly used trade names are Advil or Aleve. And then we'll move on to talk about just some topical preparations, which means these are non-steroidal anti-inflammatories and other ingredients that are applied topically on the skin. There are a number of treatments for osteoarthritis. Of course, non-pharmacologic treatments may include diet, exercise, strength training, weight loss, supports, braces, physical therapy, massage, just to name a few. Of course, I'm a pharmacist, so we'll be dealing with our medications today. Acetaminophen, most commonly known with the trade name Tylenol, became available in the mid-1950s. It was one of the first non-aspirin type medications to come on the market, and it was used widely because of its safety on the stomach, bleeding, and the kidneys. The medication acetaminophen is used for a number of different reasons, all types of aches, pains, strains, has some anti-inflammatory abilities, and of course it's commonly used to alleviate fever. Acetaminophen comes in a variety of dosage forms, including tablets, caplets, capsules, liquids, and even suppositories. It also comes in a number of combination preparations for cough, cold, and muscle relaxants included. Very easy to remember and can be very confusing, but regular strength acetaminophen tablets contain 325 milligrams. Extra strength contain 500 milligrams. Other branded Tylenol muscle aches and body pain and also Tylenol arthritis has 650 milligram dosage forms. These are released a little bit differently than our regular strength and extra strength tablets. They essentially provide an immediate release of 325 milligrams, and then the additional 325 milligrams are released over an extended period. Well, which one should I choose? Essentially, the 650 milligram tablets can be dosed every 8 hours or 3 times a day, as opposed to the regular strength and extra strength tablets, which essentially are regular release type tablets, and they need to be dosed 4 times a day. Regardless of what types of preparations you're using, from tablets, capsules, 325 or 650 milligram tablets, the most important thing is the maximum amount of acetaminophen that you should take per day. General rule of thumb for adults is 4,000 milligrams or 4 grams per day. Easiest to remember, that would be equivalent to about 12 regular strength 325 milligram tablets or 8 of the 500 milligram extra strength tablets. Side effects: acetaminophen is extremely well tolerated with very little nausea. Stomach upset as being the most common problem. And of course, when you exceed the maximum recommended daily dose of 4 grams per day, it may negatively affect your liver. Drug interactions: some medications can also negatively affect the liver, but alcohol, as a general rule of thumb, should be avoided in combination with acetaminophen because of its combined negative effects on the liver. NSAIDs, or non-steroidal anti-inflammatories. Ibuprofen, naproxen are probably the most common because they're readily available over the counter or without a prescription. Common brand name for ibuprofen would be Advil. For naproxen sodium, it would be Aleve. They also come in prescription strengths as well. Other ones to mention are diclofenac, ketoprofen, ketorolac. For all intents and purposes, they essentially work in a similar manner to help alleviate some aches, pains, swelling, and obviously inflammation in the area. NSAIDs are also effective for reducing fever. NSAIDs come in a variety of dosage forms: tablets, capsules, liquids, suspensions, suppositories, and even injections. Well, why does a physician or a practitioner choose one over the other? Well, there are a number of reasons. how many times a day they need to be dosed. Some are once a day, some are up to 4 times a day. Some have immediate release, some have sustained release preparations. They also differ in side effect profiles. Some are safer if you've ever had stomach issues such as ulcers in the past. Some are safer also if you have any cardiovascular disease or if you have high blood pressure, for example. As a general rule of thumb, one is generally not better than the other for all intents and purposes. In equivalent dosage, they will all do the same thing to help alleviate the aches, pains, strains, and any inflammation. As a general rule of thumb, avoid any alcohol in combination with NSAIDs, and as it can increase your risk of ulcers and bleeds. So there are a number of drug interactions that NSAIDs may negatively affect. In particular, blood pressure medications in combination with NSAIDs. People who are taking ASA or aspirin as a blood thinner should also consult with their pharmacist or physician. And of course, we already mentioned alcohol, trying to avoid that, especially while using an NSAID. Topical NSAIDs have become popular over the past few decades. What's a topical NSAID? Essentially, it's a preparation containing an NSAID or other ingredients that are applied on the skin. Well, why would you want to apply something on the skin? Well, when you take a tablet or capsule, it has to go through the stomach, it goes to the liver, gets metabolized, and then gets circulated throughout the entire body. So from an advantage standpoint, applying something on the skin goes directly into that area. For example, if you have issues with your knees, it will go directly into those joints themselves and stay localized. So it'll avoid the necessity to go through the stomach and potentially cause some side effects, such as gastrointestinal upset. What's more important is the actual base that's being used, because that will help drive the medication and help enhance penetration of the medication across the skin. Commonly used bases are PLO gels, Versapro, Lipoderm. There are some subtle differences. Some are a little bit more effective than others. Some are more cosmetically appealing to apply than the others. What's the disadvantage of applying a topical NSAID or topical medications in general? It may take longer for you to achieve maximum benefits of pain relief, for example, or any inflammation. It generally takes about 5 to 7 days of consistent application before you'll notice some benefits. Whereas if you take a tablet or capsule, you'll notice immediate pain relief, usually within about a half an hour to an hour, depending on the preparation you're using. Just one example of a topical NSAID is a combination of diclofenac, cyclobenzaprine, and gabapentin in a transdermal or a penetration enhancing base. Diclofenac, of course, is a non-steroidal anti-inflammatory.